Oh, so first of all, the first question is, I'd like to hear each of you discuss the key needs that you see in the communities you serve when it comes to issues of child nutrition, physical activity, and healthy weight. Marissa, maybe you can start first.
Hello, everyone. How are you today? Good. How are you today? I told my colleague, I was like, should I do the Y thing and make them all get up and get physical? I'm getting some stares. Maybe not. All right. Okay. Well, thank you. It's a pleasure to be here today. I think it is very important when we look at our communities that we look at them holistically, recognizing that the family plays an integral part. I heard the woman over here from a school district. We know that schools are critical to child development as it relates to physical activity and nutrition, and also the mental health and emotional health of our youth.
I have to agree. I think sometimes we focus a lot on the external factors, but don't focus sometimes on the internal factors, such as mental health. I can only speak for myself. I know that certain things, when we're in crisis, certain things like our nutrition and health take a wayside when we're in a crisis. So those things can impact a community, not only from the parent's perspective towards a child, but also in group settings, as far as losing loved ones and things like that. So I think that mental health is a part that we haven't focused on enough when we're looking at childhood obesity.
Good morning, all. I would agree with my two colleagues here, but would also add, coming from an economic development perspective and community development perspective, our organization has to look at the whole external piece of it. I heard somebody mention the social determinants of health, and so with that lens, we're looking at marrying urban planning and public health. So I came on board to Cooper's Ferry 2 years ago to do just that, and so looking at the social determinants of health, and when we are inviting new companies to come to the city of Camden, when we're looking at infrastructure changes that are happening, where we're looking at regionally what's happening, the external piece is really important to us, but also with the lens of making sure that we also are equitable with all the changes that we're making. So, so key needs are for us as a community development and economic development organization is looking at all the social determinants of health so we can get down to that family level as well, but leveraging and partnering with the partners that are doing that direct service with those families.
Yeah. Good morning. Is this on? Maybe it's on. So, yeah, what I think a lot of what New Jersey Health Initiatives tries to do is think about how do we really take an asset-based community development approach and think about what a community does have in contrast to a lot of times what we don't have. And I think what we're finding is that there are a lot of underutilized assets within a community. So, for example, in some of our grant making, we've worked with, I'm a school nurse by training, and one of the, I know I get a lot of weird looks like, yeah, school nurse, that's right. Yeah, it was my first job out of nursing school. But one of the things we found is an underutilized asset are school nurses, right? And so what school nurses see are kids that come in with a lot of food insecurity, right? And through weekend backpack programs, they're able to kind of connect those youth to food pantries and community food banks to kind of make sure they're getting food over the weekends, which is the hungriest time of the week for them, right? We know that. And also similarly, there's the hungriest time of the year for kids is the summertime. And so we know there is another underutilized asset in communities, that is the summer feeding program by the USDA. And one of the things that happened in Bridgeton was obviously we funded youth to go out and enroll families in the summer feeding program, and it was a great way to kind of use youth, another underutilized asset, to connect the community with another underutilized asset, which is the summer feeding program, and we're seeing that happen across the state. But I think a lot of what we can be doing as we think about what Val talked about, this health equity, this equality of opportunity, is really thinking about how do we make sure we think about the assets first and make sure we're using those assets that actually exist before thinking about what we don't have. So yeah, that's one thought.
So Susan and I are the Wickettes. Oh, this goes back a long way, the Wickettes, yes. So I guess as a program that addresses the needs of prenatal breastfeeding moms and children up to the age of 5, and women who have limited income, our perspective, or at least my perspective, is that we probably should be thinking about the interconceptual health and prenatal health even more than what we do, and that our system doesn't always allow us to do that. And so I think this is a great opportunity to, again, think about that community perspective, that we really should be working as a team. And so, like, probably all or many of the people on the panel here, if we all work together, we would accomplish more than working in our own little silos. And the good news is that I think USDA has recognized that. So for years, while Head Start and WIC has tried to work together, it was always like, oh, but the mom has to be there, or this has to happen. And so now we've got the okay to do that, and now it's a matter of like learning how to share data and bigger systems changes. I guess the biggest issue that's going on at the community level, and this is actually at the national level for WIC, is child retention. And so maybe it's a program that was designed for the previous century and it's not working so well now. So the truth is that we do very well at getting our moms into the program. We retain at least 75% of kids at 1 year and 18 months, but by the time they're 4-year-olds, we probably have 25%. And that's more of a national statistic rather than what I'm reporting for New Jersey at this moment in time. So there is a lot of opportunity that we're not necessarily using in serving our older kids, and perhaps partnering with daycares and Head Start and all that kind of stuff is an important piece. From a more universal thing, my work seems to elevate the obstacle of stigma. And I really feel that whether it's the fear of the stigma that people are going to see from the consumer behind them at the supermarket, or if it's just the attitude of the cashier in the supermarket, or if it's the fear of if a pediatrician were trying to universally screen for food insecurity, all those things are concerns that people may not be honest about what their real needs are. So I'll pass it on.
Good morning. First, let me just say I work for Rutgers, New Jersey Medical School, so I just want to make sure that, not anything against Robert Wood Johnson, but I just want to make sure that my employer was correct. And I'll just add to what my newfound esteemed panel is. Pretty much the needs assessment of our community is very important at the local level. I've worked extensively with our SNAP eligible population for a number of years, and now with our WIC population, all pretty much a low income resource audience. However, we can take the holistic approach, which we need to, or interdisciplinary approach, to ensure that we can meet all the needs of either the child-centric or family-centric model in which we choose to address. However, if we are providing that information and the particular family or child does not need that information, it's all for nothing. So whether it be a child nutrition program or a physical activity program, and we come in and you do this entire physical activity program, and we are looking at a Mexican-American immigrant population who are there sharing 15 people to a household, cooking off of a hot plate. Really, what are those interventions going to lead, or lend, I should say, if we're coming in with all of this money and all of these interventions and we're not taking the time to say, is this a particular need of this population or this particular area or this demographic, and where let's meet them where they are, and instead of trying to bring that population to where we need them to be because of our initiative.
Excellent. Can I see if any other significant needs that you're seeing in the populations that you're serving? Folks in the audience, what are some of the key challenges that you're facing when it comes to issues of nutrition, physical activity, cooking skills, or culinary skills? Yes.
Hi, my name's Carrie. I work for New York Medical Center, I'm a dietitian over there, and I work in community wellness. And I was thinking about, as we're talking, like, how do I phrase this question? You guys are saying so many really great things up there. So one of the challenges that I am seeing as I'm in several of these committees for Newark, Believe in Helping Newark, these task forces, different organizations coming together to figure out how do we solve this like very ginormous, huge problem. And what I'm sensing, and this is in my area, is that we're talking about school nutrition, and I always feel like we're talking at them, we're talking about what's going on at the school. But what I'm struggling with is, and not really so much struggling, but working to figure out this environment, is how to bring them more into the picture. So our principals, our superintendents, our administrators at the school level, our directors for food and nutrition, because everyone is like, this is the things that we need to work on. But and I don't know if you guys can touch on that. That's just something that I'm struggling with, trying to pull that all together versus talking at the schools. They're supportive of a lot of the programs and initiatives, I can say that, in their individual schools. I don't see it so much like, I don't see them as representative, and maybe that's my perspective at these different task forces and committees and, talking about school nutrition and things like that.
I think it really gets that kind of, I think schools get a lot, right? So on that side of things, the principals, the teachers, I think there's a lot of coming at them, and so I think it's hard for them to kind of sift through all that's coming at them because they're getting hit with all these curricular kind of ideas and operational ideas, and so I think that's something that I think is really important. I'm glad you brought that point out, but how do we kind of really work more effectively with school superintendents, because I think when we have them at the table, we know that really changes the conversation. They're able to kind of channel that, but I think the schools are in this tough spot, so I'm glad you brought that out.
Yeah, thank you for that question. Go ahead.
I was going to add, when we started our work in Camden City to get support for a comprehensive school wellness policy, it took us 2 years to build the relationships at the grassroots level. And that meant for us to go to the church event on Sundays consistently. Go to the stuff that just probably wouldn't make sense for a project manager to go to kind of make the tie-in to the initiative. But because it was so-and-so grandmom that was there and so pastor and so community organizer, that helped us establish those relationships and not utilize them, but get them to see the connection as to, okay, you're going through this could be connected to your child's nutrition, that could be connected to an improvement at the school. So therefore, perhaps we can work together and think about this together so you as the parent can go to the school district and bring this up. It takes time, and it takes capacity, and it takes that willingness to continue on even though it might not at first make sense, why should I go to this Saturday barbecue at this block party? Yeah, because besides that, it's probably a good party, but you'll meet the folks that will, I saw you at the block party 2 months ago. I think I could trust you now, and I think I might want to work with you. It really does take up to that level.
And I'll add really quickly, on the school level, maybe looking at student councils, PTO, PTAs, the superintendents, the principals, assistant principals are extremely tapped. They're even the Board of Ed, but just finding a couple champions within the school system, maybe hitting the lower level, not lack of a better phrase, in the very important level, but a lower level so that they have more time to even come to some of your task force meetings or you come to them again. And then that messaging can be presented to the superintendent or principal from different avenues, not only just from the task force, but within their community and outside of their community at some of these community events within their school system. And it's kind of like, well, this must be a really big deal because I'm hearing this everywhere. You know what I mean?
I think also it's important that you're coming to it. So we know that everyone is invested in the health of our children, right? That's a given. But what are you going to the door saying that you have that they're going to get out of this? So if you're speaking to, the nurses and you're able to say, okay, well, if we implement this food program, you're going to have less injuries on the playground, or less children are going to come into your office because they're hungry in the morning, or whatever. What is that add-on for them? And being able to articulate it in a way that resonates is really important. And you obviously need to develop those relationships, to Val's point, first, so that you know who you're talking to and what gets them motivated.
And how you're going to sustain it, to your point.
Exactly.
Because a lot of school systems get very frustrated that we come in with all these programming and grant money. We're coming there for a year. We help them out. The school system enjoys it. And then Rutgers or Robert Wood Johnson or whoever, the Y, leaves. And then the whole infrastructure of what we built up in programming is now gone. And they're like, well, why bother? Why am I going to do this? Because we're not going to, this is not going to be sustainable.
I have to agree with that too. There are many times that we've tried to partner with other school systems, and they've just been burnt by something previously that another agency or another health system had done, and they just aren't willing to do that and go through that again. So yeah, we really need to look at the long term. How are they going to be able to continue to sustain that? And also to build on what you said, so what are you bringing to the table for them? Everyone has goals at the end of the day. We need to achieve them. So what are you going to do in order to help me achieve my goals? So you have to bring up school attendance rates. How are your attendance rates? Maybe there's something we can improve upon. Also, what about your grades? How are the grades looking for the children? How are the tests, standardized tests, how are your scores looking? This is something we can improve upon when we implement a better nutritional program for the kids.
Thank you so much for your question. Yes, please.
Hi, good morning. My name is Suzanne G. I'm with Virtual Health System in South Jersey.
South Jersey, all right.
South. So Virtual operates a year-round mobile farmers market that has grown to become the nation's largest farmers market in the country. We serve 9,000 adults, 2,000 children. We take SNAP benefits. One of the things that's been tremendously frustrating is that we cannot take the WIC cash and value voucher because I'm a health system and I'm not a farmer with 5 acres of land and I don't grow 7 things. So I've been advocating for policy change at the state level, at the USDA level, to allow for more innovative providers to accept WIC CVV. Just to give you an example, I asked the State Department of Health to provide data on CBD utilization in Kansas City, and last year it was less than 2%. So that means that $8 fresh fruit and vegetable voucher is being utilized by virtually nobody. So I was just wondering if you had any insights or if there was any advice that you could offer.
But I will speak to, it's not very pointed to response from Europe, but we have seen the issue with our farmers, and I'm in a very urban area in Newark. This is not, I'm from Brooklyn, project my point. So, but I'm getting at that, so. What we have is a partnership with our farmer in the urban area. So during the farmer's market time, he actually brings the farmer's market to our office. So when our participants are receiving their checks, they're also receiving 2 bags of fresh produce, and they're utilizing their WIC checks. So that's just a local agency answer on how, but in terms of how your particular farmer's situation can do.
And it's interesting because I don't work with a farmer, I work with a retailer.
Yeah.
So my supplier is Whole Foods, and Whole Foods allows me to purchase from them at wholesale pricing, and then we discount that produce by 40 to 50% to make me eat healthy, the easy choice.
Right.
So the partnerships and the collaboration is there within the community. It's just we're turning people away when they try to use that CBD voucher.
So just to clarify, there's actually 2 different fruit and vegetable programs in WIC, and one is the farmers market program, which is seasonal, and a part of the mission of that is to help farmers. And so that's why the regulations are the way they are. So as Susan said, certainly,
Yeah, there's just no farms or farmers in Camden City, so that's what, like, I run into.
there's lots of farmers in South Jersey who are looking for places to sell their produce.
Great, thank you. Some questions on Twitter.
All right. Do you think those in poverty-stricken communities lack the community resources needed to understand the importance of prenatal health on growth and development? Sorry. Do you think those in poverty-stricken communities lack the community resources needed to understand the importance of prenatal health on growth and development?
No, I think that our families, again, I think everyone recognizes the importance of the health of their children. It's about the capacity of the families, and it's about the resources and the knowledge that they have about what's available in their communities and what they may be dealing with on a daily basis. So I don't think we should ever blame the mothers or the fathers, but I think it's our role as humans and community members to make sure that families know the resources that are available to them and are given the opportunity to take advantage of those resources. So we may have great programs for prenatal parents that are, 2 miles away, and maybe it's not on a bus line, or, transportation could be an issue, or there's a number of different things that are plaguing our communities.
I agree with you 100%. In addition to that, harking back to what I was saying, understand there are a plethora of resources, prenatal resources out for our low-income populations. There's also a lot of us. Thank you. Hello. Okay. There's also a lot of assumptions that are made about our low-income population. They don't use smartphones. We can't use, established marketing programs for them. There's not ways to reach out to limited resource audiences that we will reach out to the general population. But then there's also other barriers, transportation, how many times I have to take my child out of school for a particular appointment, whether I have to take them out to do their Medicaid application, food stamps, they're required to bring their kids to WIC. Now my child is a truant. There's immigration fear around coming out to certain programs and being, so although in certain of our federal funded programs or our resources that are out there, we may not see the amount of participation that we would assume is needed because there's an assumption that this is the population that really needs this information. Here we are saturating the community with all these resources. We again need to sit back and think about the client, where our people, where our community is and what those barriers are. So it may be going again to the health fairs, to the churches. It may be a basement. It may not be a glassy, FQHC. It may not be. It may be a family success center for people, and it may be a promotora. It may be a peer counseling session. It just may be different avenues and ways to get those resources out. So you may not see a room of 50 people like in a different generalized audience, but you may see 10 rooms of 10 people, and we're still getting that information out.
Thank you. Yes.
Hello. Oh, thank you. So I agree with the points that were made. To the saturating of services, what we're trying to do is, so we actually partner with Virtuous Farm Market, and we help them select the sites specifically that will have high traffic, that would be connected to other things that are happening. So when we're looking at placing programs or initiatives or services, we're looking at what else is happening versus just throwing something in somewhere and just thinking that it's just going to work. So for example, the second site that we were able to confirm with Virtual Mobile Market is down the street from a church, down another street from a library, up a street from a housing complex that's being built right now. Our organization is actually going to be redoing the park that's where they're parked right in front of, and there's a senior center up the street. So now we're looking at the whole neighborhood perspective. So the chances of that mobile market being successful, but also having all the families know that it's there. So now there's opportunities for virtual to be able to say, you know what, our nutritionists can now add on more services, or we can add on a nurse to come, or whatever the case may be, because now we're looking at this whole piece system. So back to the saturation of programs, I think we need to be strategic as to how we saturate and be thoughtful about making sure that everything just connects well.
Thank you. Another question or comment?
Hi, I'm a retired school nurse. That's the reason I smiled at you. And yes, well, that too. So my question is this. We certainly know we have a food insecure population within wealthy districts as well. I was in Bridgewater, Bernards Township, and now that I'm retired, I am still working with food insecurity. As a school nurse, we got from our population, I would have food drive for Thanksgiving, I would have Christmas gift drive for the children at Christmas. So now as a private volunteer, I work for God's Co-op and through our church. And my question to all of you is, I'm very, very interested in this farmers market, and how are you partnering with the churches throughout the state? Because I really see that. We know what our population is. We have a huge Guatemalan population, and so as a church, we have people who speak Spanish, and when we give out food, like 3 to 4 times a month, we have 60 people come, 60 different people. There are no questions about immigration. There's nothing. We feed them. Now, we buy that because of the donations that are given through the church to support God's Co-op. Now, my question is, how do you partner? I see you taking your information from us and saying, okay, let's find out all the churches, ask all the ministers who have this kind of a situation like we do, the co-op, and how can I get the mobile fruits? Because I will tell you, during the summer, if in Bernards Township, we have little farms. We have our little backyard gardens, and everybody says, if you've got extra, bring it, and we'll put it at God's Co-op, and they can come and do it. But we do not have enough fruits and vegetables. By the time that the 60th families come, they're there and there are no limes left, or there are no fruits and vegetables left because we run out. We do have someone in the, I'm not sure I don't think it's Whole Foods, but I think it's another local, maybe Stop and Shop or something that gives us their produce, but we run out of it. And so if you could tell me how, and tell all the ministers how, if they're part of this program, how they can get enough to feed 60 families or 150 families, then we could have a more balance. Because I do see, as a school nurse, I'm still seeing it when I go in and sub, we have a population that is overweight, our immigrant population. So we're going to be dealing with that for generations to come.
So you're asking how to connect to the farmers markets.
How do we connect to the farmers markets?
So in the city of Trenton, we were able to create a Trenton Healthy Food Network. And the network consisted of nurses and people who are interested specifically in food insecurity in the city. We were able to pull together all of the food banks and pantries and faith-based institutions who were giving out food, and begin a organizational structure, for lack of a better term, around communication. Because that seemed to be the biggest thing, is that, Shiloh didn't know what Union Baptist was doing, and, so on and so forth. And so really putting together kind of a network of places that were addressing food insecurity really helped kind of get the ball rolling and get the conversation started. We were then able to map where all the locations were, which was really helpful to our families, because we also know when we talk about food insecurity that the government sees you as only needing food for 3 days, right? But we know that people then go to multiple pantries and multiple services because 3 days isn't enough to feed an entire family. And so then they're accused of like, oh, they're hopping and they're shopping, when really they're just trying to feed their family for that month. So it's really important first that you look at kind of where all of the food places are in your area, and then be able to connect them with either your local farmers markets, or there's Farmers Against Hunger. And so they do their gleaning, and they actually go out to different organizations all across the state of New Jersey and provide the leftover fresh fruit and vegetables that they weren't able to sell. And we actually have someone here from the Department of Health, Stephanie, calling you out, who manages the SNAP grant. So there are 3 entities in the state of New Jersey: Zoo Falls, the Community Food Bank, and Rutgers Cooperative Extension, that are all now charged with getting that fresh fruit and vegetables and a bunch of different initiatives out there. But I'm sure that we could connect you to who's in your area.
Right, and to just pick up on what Marissa said, several of our panelists are part of these cross-sector coalitions that New Jersey Health Initiatives has funded across the state, which really are trying to leverage the assets of cross-sector partnerships, right? Because we know that when we sit around the same table and have one conversation with our community partners, we know that we're able to kind of build trust, but also kind of figure out what assets do we have that we are maybe not connecting. And so getting more kind of faith-based groups at that table is really important. We don't have enough of those, and we can connect you. Marissa will help us connect you, make sure that there's probably a coalition near you. If there's not, that's how we should be doing our funding anyway. We should be funding through cross-sector coalitions. We can't be doing these one-offs where we're just funding one group to kind of work on their own, go it alone. We have to make sure that we're having one conversation about each community. So that's what we're doing in Perth Amboy, and Asbury Park, and Bridgeton, and Salem, Atlantic City, Trenton, Camden, Newark, Elizabeth. I can't forget Elizabeth. We love Elizabeth, shaping Elizabeth. All across the state. And that's kind of where we're kind of in Newark. I mean, that's where we're kind of seeing the real kind of opportunity, and also this real kind of opportunity to kind of like really get some traction and get some momentum that we can sustain. Because the kind of trick of it is right, when we mentioned that in this already today in this conversation, is when the funding goes away, if we haven't kind of built on assets that exist, then it goes away, right? We've lost all our momentum. So we have to really think about sustainable kind of achievements through kind of cross-sector partnerships.
And just a real quick commercial in adding to that is that when you are looking at those assets and you're trying to find those partners, and we have those food distribution programs, food banks, and making sure you partner with nutrition education as well, so that you educate the constituents or participants on how to utilize the food that they're getting. Because a lot of times we're disseminating food, the food is going, participants are picking it up, bags and bags of food, and either they're dumping cans when they walk away because they can't hold 3 children and the heavy cans. They don't know how to use the fruits and vegetables that they're not familiar with. So making sure that when you utilize all of these connections that you make within that nutrition education, just a commercial, nutritionist that I am, that nutrition education is part of it, recipes are part of it, food demos are part of it, because that really helps that holistic approach again.
Yeah, I have to add a little bit to that. Also with the coalitions, for Live Healthy Bridgeton, we've actually even got together with the Live Healthy Salem coalition, and we're helping them do a similar thing that we've done in Bridgeton with the mobile feeding unit that we have, so that they can kind of see how did you do it, what would you suggest to do it better. How much did you spend on these kinds of things? Where did you get these things? So that we can help them do the same thing that we're doing in our community. So working together with other communities who are doing the same thing is going to help you build on that for sure.
So, yes, go ahead.
David Juros from Wholesome Wave. I just wanted to add on another type of program that we do, which helps to bring fruits and vegetables to low-income communities. Nutrition incentive programs, where we work alongside of all of the great work that's being done in this room, mobile markets, farmers markets, and allow low-income populations to be able to better afford fruits and vegetables in their grocery stores wherever they shop. So it's another opportunity to work alongside, help to supplement the other programs that are there, and bring more affordability to grocery environment wherever they're shopping, to specifically buy more fruits and vegetables for their family.
Thank you. So let me transition. So we've already made the transition from challenges to solutions, and I love the thought process and the excitement about providing solutions to these challenges. So let me ask the panel, tell me a little bit more about some of the other solutions that your organizations or your communities have come up with to addressing these issues of nutrition. And let me also ask you to talk a little bit about physical activity, because we haven't talked a lot about that just yet. If you could just tell me a little bit about the kinds of things you and your organizations are doing to address those issues. Let's talk about solutions now, more solutions.
So actually, to piggyback, we have a great partnership with Wholesome Wave. About 5 years ago, we started the Greenwood Ave Farmers Market, which is located behind the Trenton train station in a low-income, high-crime neighborhood. There was an empty parking lot, and one of my colleagues, Beth Fian, we were looking out the window, and she was like, "That would be a great market." And we were like, "Yes, it would. Let's talk to the community." And we went to the community, and the community said, "We don't want a farmer's market. We want health services. We want a place to play bingo. We want a safe place for our kids to play. We want healthy food, but we don't want a farmer's market." And so we were taken aback a little bit, and we realized part of it was in our communication. So we're speaking to multilingual and monolingual families and using the word farmer's market, assuming that everyone knows what a farmer's market is, right? So we have to think about that when we go into communities, make sure that we're being culturally competent and aware. So when we called it a bazaar, we got a lot more feedback and response. So that was something that we learned. And so what we were able to do, because we know that it's a food desert, but maybe our families don't necessarily know, what does that mean, right? And especially our seniors, who are very loud-spoken, right in the towers behind the Trenton train station. If you're familiar with Trenton, you know our seniors are quite vocal, which is a good thing. You want to talk to the vocal people. And so, you know, this one woman pulled me, "Baby, I said I don't want no farmer's market. I want to play bingo." And she was out there every day, every Monday when the market opened, playing bingo. And so how we were able to bring the people to the market was literally we partnered with our city, we partnered with our Capitol Health and Henry J. Austin to make sure that we had health services available and a mobile van through the Trenton Health team. And so we were very fortunate that the community, and this goes back to partnerships and relying on other assets within your community to bring it all kind of to one-stop shop. And so with the food service vendors there and our farmers and the health services and bingo, of course, and activity for the kids, we were able to accept WIC, make sure that we accept SNAP, and then got private funding from Robert Wood Johnson to do double bucks. So they were able to double their money, and Wholesome Wave to provide their dollars as well with their good food bucks. And so it's now grown, and so now we see over 5,000 attendees. We are the only farmers market in the state of New Jersey to do a summer meal program, which you guys spoke about the importance of that. And we are also the #1 WIC redemption rate, which I'm very happy and proud to say. So thinking kind of outside of the box and really making sure that you listen to your community and what they have to say and trying to tie it back into what your goals and objectives are really important. And again, being true to the community and making sure they're a part of it is important. And bingo for seniors.
Seniors are so vocal. I remember early on in our initiative going to a church to try to do a faith-based policy and some changes in the congregation. And we kept on saying healthy, 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 healthy. To weeks later, it wasn't until this one senior said, "You keep talking to me about healthy, but to me, that sounds like you're giving me bird food. And it sounds to me like I'm going to be hungry after I eat whatever it is that you're trying to tell me I should eat." And lesson learned, I asked her, what would resonate? Like, what would make sense for me to say to you or to anybody else? And she said, "Well, if you talk to me about what could help me lower my blood pressure or impact or better help me with my diabetes, now we're talking." We're technically talking about the same thing, right? but I addressed it in that perspective instead of saying the word healthy. Took the word healthy out. Not a big deal to do that. But I said, if you have, and it sounded like it resonated with everybody else after asking a couple of more questions. I said, lesson learned. From now on, I'm not going to say the word healthy. I'm just going to say, hey, if you are dealing with diabetes, high blood pressure, or any other diseases, these are the kind of things you need to be looking at, plain and simple.
Yeah, and I think, as all of you know, it's much easier to prevent obesity than reverse it. And so for us, a lot of what we've tried to do is to think about how do we engage, again, those assets. And so I talked a little about kind of engaging youth, and I will give you a soft brag about an initiative we funded in 2017, which funded 10 organizations across the state to work with teams of youth for a year to develop a project that they implement as their summer employment. They get paid all through the whole process in terms of developing the project, working with the community, and you won't be really surprised to hear that they came up with ideas that we never would have come up with. And so in Bridgeton, so they had the summer feeding, but they added another kind of activity portion to that, went around with the kind of their big mobile van, and they did a great job there. In Atlantic City, they put a twist on the summer feeding and kind of connecting and putting activity into it, working with older adults. Same thing in Elizabeth with Groundworks Elizabeth and Shaping Elizabeth. And so, yeah, and I guess I kind of really want to second what Marissa said about thinking about how do you work with the community, because we do a lot to the community, right? But I think we really have to think about how do we work with the community, right? Because I think they're used to us coming in and saying, oh, we have all the answers, and we have to take the control away from ourselves, right? So as a grant maker, I mean, yeah, our impulse is to say we have all the best ideas. We'll tell the community to do, and of course they're going to do it because we're putting funding behind it. But those aren't the best ideas. The best ideas are when we kind of give the community the power and give them the opportunity to kind of work together, come to us and say, here's what our community needs, because we don't know what Perth Amboy or Asbury Park or Bridgeton or Salem or Atlantic City needs. We need to listen to them. Like Marissa said, listen to them, work with them, allow them to kind of come up with the solutions, and then they're going to buy into them a lot more and implement them much better than we could. And so, yeah, so I guess that's a really important piece, is really keep that in mind.
Yeah, please. What mom does not want their child to sleep through the night, especially when they're newborn, and they don't want their baby to cry? And so we used those strategies through a training that we had with UC Davis on baby behavior to approach things a little bit differently. So in other words, it's the lesson of, if you have to recognize what you're doing for years and years and years is not working, and figure out a way to do it differently. And so our strategy was really to help moms, not so much by telling them these are the infant feeding guidelines and this is what you're supposed to be doing, because they've been around forever and they haven't been so successful in being followed. So our strategy was more about helping moms to have realistic expectations. And if you do that during the pregnancy, then it's not like it's shocking for a new first-time mom to wonder what's wrong with her baby, that it doesn't sleep through the night. So those are the kinds of approaches that we've been taking. Of course, in addition to that, we're really big on breastfeeding and all of the pieces of the puzzle that have to come together to make that successful, including what happens in the hospital before the mom comes home. And so it's just making the logical changes. We've partnered with other people to try to do some policy and environmental changes. So all the things that you think, at the state level they'll never change, and USDA is unwilling to make any changes. But in New Jersey, we now have open access for WIC vendors. So what that basically means is that we have more grocery stores, and any grocery store that wants to become a WIC vendor can now apply. We're changing to 1-year certification, so families don't have to prove that they're eligible income-wise to come in every 6 months. Now they could do that once a year. They still have to come in every 6 months for other things, but they don't have to prove their income. We're taking steps for EBT, or in other words, it would be like the debit card at the register to make, it won't be paper checks, and that should be happening in 2020. And the other thing I wanted to mention is we can't do things alone, and we really need kind of a top-down, bottom-up approach. There's so much that can be done through state partnerships, but we really also need things at a local level. And so the example that I want to use is last year we did a food insecurity toolkit in collaboration with New Jersey Academy of Pediatrics. And we were hoping that pediatricians would take on universal screening for food insecurity and then have resources to refer, so whether it's SNAP, WIC, and of course food banks. But at the state level, we just can't keep up with all the wonderful things that are happening at the community level, and we really need some way to connect all those dots. So it's something that we can do, but we do it best if we all work together. State level, local level, just everybody.
So really quick, I think that the solution is collaboration. Shocking that I would say that, right? So we've talked about the community collaborations, but I also think that we need to be mindful of collaborations within our institutions and within our own agencies. So for example purposes, I'm at Rutgers NJMS. Across the street from me is University Hospital. I partner with the School of Public Health, the dietetic internship program for students to come down and do nutrition education programming, physical activities with my moms. I partner with the Breastfeeding Task Force because it's a baby-friendly hospital. We partner to do parenting centering where moms are doing yoga for physical activity, where we're coming in and doing nutrition education. And I don't have to do anything but cross the street. Okay, so I don't have to, and that is on top of my community, my assets and my community partnerships and what my needs assessments are. That's just me saying what's right here at home that I could utilize that takes, you know, a big bang for my buck, a low effort. You know, I can partner with all of these entities. They're right here on campus, if you will, and they're able to deliver the deliverables that I need around child nutrition, around the incentive programs, and I can supplement that with my WIC education that's necessary to answer your question.
Thank you. Absolutely, please.
I think that it's not liking me, sorry. It's just,
So to go back real quick about physical activity, that's something you've heard a lot about, the food access piece. And I think physical activity is a little more challenging in that we know that the research shows us that, you know, the programs are great, but they don't really get to the heart of it. So, right, we focus on the PSE, the policy systems and environmental change, and what that looks like to reshape communities. And so, especially in our low-income communities and in our rural communities that maybe lack sidewalks or appropriate places to play and playgrounds and things of that nature, we think about, you know, the policies like Complete Streets. Who here knows about Complete Streets? Okay, a few of you. Good. So Complete Streets is basically a policy that says for all new project construction, you must create the roads and the streets in a way that's accessible to all users. That includes walkers, bikers, people taking public transportation, strollers, all of that, which is a great policy. But what does that look like then for the implementation? So policy is the, you know, 10,000 foot level, right? And then we get down to like the brass tacks. So what does this mean for our communities? And so back in 2012, Trenton passed a Complete Streets policy. It was ranked 8th in the nation by Smart Growth America, which we're really proud of. But we didn't have our first ribbon cutting for our first Complete Street until last week. Yes, last week. That is a couple of years in the making, right? It was well worth it. So we were able to have our bike lanes, dedicated bike lanes, not just shared lanes, with colored paint so people could be aware. And there was a whole movement with DNR Greenway that handed out really cool flyers that had dollar bills attached in an arrow to reinforce what it means to ride safely on a street. And particularly those of us in public health, we often think about these things as health and, you know, health in all policies, which is great. But what we need to recognize and remember is that transportation biking is transportation, not a leisure activity for a lot of our families and a lot of folks in our community. So they're thinking about biking as a way to get to work. And if we're coming to it as, oh, this is great, you're going to elevate your heart rate, like, what are you talking about? I need to get from North Ward to the South Ward. So I think, again, that goes back to how we communicate with our constituents and with our residents, but then also recognizing that it takes a long time to reshape our communities, and things that may seem simple, like putting paint on the lanes, right, can take a very long time and be a heavy lift, and really go back to your point about collaboration. And we had 4 mayors involved in our Complete Streets policy. So, yeah.
It's a bit easier for me to speak to walkability and bikeability because of the nature of what we do. So a big major infrastructure space that we're in is improving our park system in the city of Camden. A lot of our parks are underutilized, and we do have a lot of vacant lots. And so we have an initiative called Connect the Lots, where we're purposely using those spaces to do activities and bring the community out. That includes our parks, that includes just open space. I encourage all of you to consider, instead of hosting events at your community center indoors, use outdoor space. There's nothing wrong with having a meeting or just having a walking opportunity outdoors. You can do that, and that's an opportunity to just get everybody out. We as well have a Complete Streets policy in place, and so a lot of our thinking is pertaining to that in traffic calming measures, streetscapes changes, in making sure that things are lit properly, landscaping. All of those things are part of a Complete Streets or Complete Streets changes moving forward. So to physical activity, yes, it doesn't have to be for recreational purposes. It could be another mode of transportation for the family that doesn't have a car.
Thank you.
Yeah.
Thank you. So we have 15 minutes left. And I know there are questions waiting to be asked. We'll have some time at the end of the day to ask some of those questions. But while we have the panel here, I want to ask this final question, because I think this is really important for the New Jersey Healthy Kids Initiative, for the New Jersey Institute for Food, Nutrition, and Health, and for Rutgers as an organization. So what advice would you give us, and that us is the initiative, the Institute, and Rutgers, in how best to be working with communities, engaging communities in not only programs, but also in research, to try to learn, to try to evaluate, to try to implement? How would you advise an organization like ours and an initiative like ours to do it the right way?
I guess I'll start since I have the mic. I guess back to our first point is to really consider that voice, that community member, that resident, and if it seems like if it's not that easy for an institution as big as Rutgers to do that, is just go to the local organization that does have that capacity, that does have those relationships, and work directly with that organization there. So there's plenty of organizations that we could probably think of in any particular city, but it's really sitting down with that organization and saying, we really need the voice of the community. How can we do that, and consistently, and following up? Not just be a one-off thing and your name shows up one time, I think that was mentioned before, but really following up and having that consistency with that nonprofit.
Right, and to pick up on that, obviously, university has this tri-part mission of service, of education, of research, and I mean, when you look at the state of New Jersey, I mean, they're an important anchor in kind of looking down the state. Newark, New Brunswick, Camden. I mean, they have this presence. And so I'm looking at my colleague, Michael Yedidia, because I think when we think about what can really happen when it's done well is when you have a individual, a researcher, a scholar who comes in. But I think, Michael is actually doing some work right now for the foundation to evaluate the coalitions that we funded. And what he did at the front end was said, okay, we're not going to tell them to be evaluated. I mean, because I think a lot of communities have been under the lens for a long time, and they really, they pull back. And so I think what we have to really understand is how do we come in there, and in the way that Michael did was in his team to say, we want to be a resource to you. We want to bring kind of the assets, again, of the university and higher education into the community and think about it that way as opposed to, and I think you've heard this on the panel, we can't just keep going, what can we get out of the community? What can we add to the community? How do we work with the community as opposed to doing to the community all the time? And so I think that's the important way is the kind of way that we orient ourselves in thinking about how we work with the community, how we think about the community, how we kind of get in there. And a lot of it is kind of, again, what you heard in this panel, a lot of listening, a lot of kind of partnership, a lot of think about ways to kind of engage assets. There are things that the universities and university institutions and units can be doing that we're not doing, that we can do a better job of doing. But a lot of it has to start with thinking about how we go there and think about working with the community as opposed to kind of like, again, taking it out of the community.
I'll go ahead and build on that a little bit. I think that what you really need to do is not to go with a specific approach in mind and to look at it from what the community is telling you. You really want to hear them on their level. So you may have a community that is extremely diverse, and one part of that population may see one thing as the most important part of why there are obese children in that area, and the other part of that population may say something totally, completely different, but they see it from their lens. So that you want to be flexible in that way, that you don't look at something from one angle, you look at it from all angles.
My advice would be to think out of the box, to not, as in the field of nutrition or in certain programming, we tend to think that this is what our intervention, or these are the people that need to be at the table. And I find over the course of my career, the most success I've had is when it wasn't the like person or the like department or the like agency at the table with me. It was having nutrition education on the Greenway, which I would have never even thought of saying, okay, let's do a nutrition education program while people are walking their miles, or, you know, let's like join in with other programmings that I would not think nutrition would fit in perfectly, but then that was where I garnered the most exposure, if you will. Then I would only not research the population or the community, but I would research the programming in the community. Who is doing the interventions very well, so Big Rutgers doesn't come in and tell them, we're gonna do it, but here it is, I've done this for so long, we've done it, we have the buy-in of the community, they trust us. Instead of smash that because Rutgers wants to come in to build new programming, really embrace that and research what's here in the community, what's really working, how can that be added to our initiative and our programming, how can we work together, and even if it's not a like entity, like how can we garner that relationship that's already established, where can we go with that? And then finally, when you are looking at the community and we're looking at grassroots task force, advocacy groups, ensure that a community member is on there. You know, like people from the community should be advising the big entity as to what would they like in their community. That goes back to the needs assessment, that allows them buy-in, that allows trust. It shows that you really are caring for what the community, you're not in this big tower saying this is what we think you should do and we're gonna make it happen. That's us.
Thank you.
And I think that has to be during the whole process, so that you don't have like a master plan and then like be presenting it to the community after. And I think flexible strategies and sustainability is a huge piece. We've all talked about that before.
Thank you.
I think also, and this was already said, but identifying those change agents within the community. So whether that be residents or trusted organizations that have gained the trust of the community, as well as faith-based institutions are really a place to go. We did a poll and we asked people, who are the top 3 people that you listen to? And it was their pastor, their faith-based leader. It was Michelle Obama. This was when Obama was president. And then it was their doctor was 3rd. So I think it's really important knowing kind of where residents are getting their information and who they're listening to and who they trust. Also asking those, her arms are great, aren't they? I love Michelle Obama's arms. Anyway, side note, talk about nutrition and physical activity, right? but also asking those strategic questions. So what you really want to get to the root as, and asking those questions are really just going to give you more information to reshape the next set of questions. And then where the research comes into play, I think often communities aren't given the information as it comes in. So now you've researched, okay, so what did the research say? Where can we go from here? And keeping the lines of communication open the entire way and developing a strategic plan for communication and how you're not just going to communicate to and at the community, but how it can be cross-cutting.
Wonderful, thank you. Did you want to comment?
I want you to follow up just a little bit on your discussion that's been going on the last couple of minutes. This is a fantastic panel. One of the things I wanted to ask you about is, what do you think about the role of the child, him or herself, in a study? And I mean his or her views and feelings and aspects of his or her life in this initiative. Because I've been struggling with this for a while, and from the research area, we always say, a child is not simply a little adult. So a child may think very, very differently about some of these aspects of his or her life. And many of the studies, even though we recruit children as participants, but I'm struck with the idea that we really don't drill down perhaps into their perceptions of all of this education and information that we're providing, particularly if we do studies in which we're looking at children, say, 5 and above. They could have maybe a much more active role as opposed to being a participant. And I'd just like to hear what this NEEDS panel thinks about that.
Thanks. Any thoughts on that, especially folks that work with youth consistently?
No, I think that's a great question. I mean, and so I think one of our goals in our grant making is to really think about how do we make sure that at these cross-sector coalitions, how we bring in all these different diverse voices to the table. And one of the things we realized in our first round of grant making was that we didn't have youth at the table, right? And we know in our most vulnerable communities across the state and across the nation, youth sometimes represent up to 40% of the population. 40% of the population is under the age of 18, which kind of boggles the mind a little bit, because that means almost 1-to-1, right? One adult for one youth, and they do have a different perspective. And it's not just a different perspective; they have different information. They are a couple years away from being adults. They are a couple years from being our mayors, our city council persons. They're being on our school boards, running our youth leagues. So I think it's so important that we try to think about how do we make sure that we're not just getting from them, but working with them and using their voices and their perspective to inform what we're doing. Because I think it's obviously you can tell I care about kind of how we engage youth, but it's something that I'm really glad you brought up.
But particularly if you're going to sustain them and you really want to sustain them, they can tell you how to do it.
Yeah. In the Live Healthy Bridgeton Coalition, we decided to go out into the high school in Bridgeton and to ask for surveys from the actual students, asking various questions about what they felt were the health needs of the community. And we also, in turn with that, wanted coalition members that were part of the community. So we also tried to recruit some of the high school students into the coalition so that we could get that voice as well, because it's such an important part. Like you said, 40% of the community is under the age of 18. So that's an extremely important part to get. And I think that their perspective is a lot different when you're looking at it from not a 9-to-5 job perspective. So I think it's very important. And that's kind of the way we approached it. So.
Thank you. Yeah, one more, please.
So I was also struck when I first started 8 years ago with the Trenton YMCA. They did a photojournalism project, and so they had second graders go around their community and take pictures and talk about like the day in the life of what I see, and seeing from their perspective, even just an adult standing tall, like their pictures are coming from literally a shorter angle, and how they view the community is completely different. And it was very eye-opening having them tell their stories of this is what I see, and one of the students took a picture of they got the backpack, the weekend backpack I think you talked about, where you get food over the weekend because you're food insecure, and how there was a stigma attached to that. And so that project actually allowed us to change the way that we distribute the food on the weekend so that the students aren't identified. And so I think it's a really great point that you make, is making sure that we're talking to the youth, because we don't think about these things. So, they got called down to the office and then they got their bag and like, oh, you get the weekend backpack,
And from a research perspective, those same students or individuals may be people that we're trying to get biological samples from if we're going to do a longitudinal research studies.
Right.
Thank you.
Yeah.
So if I can just ask, Jonathan Pearson is one of our other panel members who's here. I just want to, from the Horizon Foundation, I just want to ask your opinion and your advice on some of the strategies that you've used as a corporation in working with communities. What would you advise our organization, our initiative, on how best to do that kind of work? Because you have experience in that area. And thank you, Jonathan, for being here. We really appreciate it.
Good morning, everyone. Sorry I was late. Three sons to get to school, so I apologize. But glad to be here today, and glad to be with my colleague, Liz Rubin from Horizon as well. Really interesting commentary from the panel. What I would say from our view, and folks talked about it, we're interested in partnering with organizations, whether it's Rutgers on the academic side or research side, as well as nonprofit, community-based organizations. We're a statewide Blue Cross Blue Shield company. We serve all 21 counties, and we have about 3.8 million members that live, in our 21 counties. So we're really interested in the health and well-being of youth. Our Healthy You initiative with the YMCA is one example of that. Our program was with the State Alliance of the YMCAs. We serve about 90,000 children, ages 3 to about 14. So it's really about partnership. It's really about data, and you're going to hear a little bit more about data and evaluating how we can utilize data to become more effective in our interventions, in our grant making. Our foundation invests about $5 million a year with New Jersey-based nonprofit organizations. Big part of our portfolio is around obesity prevention and education, as well as diabetes prevention and education. So we're seeing the statistics, right? There's new guidance that came out actually this week about in terms of physical activity. So we're trending the wrong way in terms of the percentages, and we're trying to mitigate as much as we can related to our work. But it's about partnership, it's about communication, it's about using data, and really coming together, because there's so many interesting organizations doing terrific work. I think someone mentioned it on the panel. Look at the local community need and the folks that are doing the work in that community, because New Jersey, from my view, is so different. When you travel around the state, it's a very small state. Now, I was in Atlantic City yesterday, in Mount Laurel and Cherry Hill, and back to Newark. It's very different. The communities are very different. So I think you need to look at bringing that knowledge base, or from a Rutgers perspective, kind of maybe 30,000 feet of how we can effectively move the needle, but also get the local community involved. And someone, I think, also said it, look to our youth, because they're going to be the caregivers of, being mayors, being council folks, being involved in youth activities. So that's very important to shape those behaviors as they become young adults and have their own families, have their own children, et cetera. So again, I'm glad to be here today. Thank you for the minute to comment. Everyone has been terrific, and again, I apologize, but I'm here for the rest of the day, and any questions, I look forward to meeting most of you here today, so thank you. Appreciate it.
Thanks, Jonathan. So I just want to thank the panel. Thank you so much. This has been better than I ever would have imagined. I hope you enjoyed it.